Mr. Rohrabacher.
Thank you very much, and thank you to our witnesses today. Let me just, this is not directly on technology, but it's dealing with the VA issues. Some of the things that you're describing that have motivated you to focus on trying to find technological solutions, like depression, sense of hopelessness, etc. A lot of that can be traced, some of us believe, to the use of opiates by the VA. And some of us believe that the VA has taken the easy way out simply by prescribing opiates to somebody with a problem, which when you prescribe that kind of drug, you're going to end up with someone with serious problems. Now, just a question, should the VA be permitted to use cannabis? Should they have that as an option rather than just opiates? And I got some other questions that go directly to technology, but could I have your opinions on that? Just a no, yes, no, or something like that?
All right, I'll jump in.
Okay. Should cannabis be an option for VA in terms of treatment of our folks rather than just opiates? Well, it's not just opiates. We're doing opiates.
I understand your question.
Okay, you got it.
Well, I've been doing this for 10 years.
Yes.
And I've had over 30,000 veterans come through my program. And I will tell you unequivocally that many of the veterans in our program use cannabis. And they use it as an alternative to opioids.
Is that good?
It seems to be working because they're all still alive.
All right. Does anybody else have opinion on that? Okay, I won't force you into coming publicly on that. Okay. Yes, there are controversial issues. I would suggest that it is sinful that we do not permit our veterans that option. The veterans, if doctors, I know I know a number of veterans who the doctors have had to pull aside and go to them in their in a off-campus, situation where they could then recommend marijuana, and it's ridiculous that we have to put doctors in a situation like that where they can't even recommend what they think is the right treatment. Mr. Meek, I should say, you mentioned that it is difficult for medical devices to get approval, and maybe you could give us some. We find that same true with commercial items as well, like the FDA and others, and as well as other regulatory things that are. Could you give us a little more detail on that?
Sure, and you talked about the FDA specifically, and I'll reference the exosuit, which is the primary device that we fund. There certainly you have to go through many phases of the clinical trials, then you have to go through different phases for FDA approval, and that takes years. I mean, literally years.
And people are suffering during those years.
Exactly.
By some. And do you have an example of a device that was left behind or delayed so much that people were left to suffer?
Well, again, just not to be a dead horse, but the exosuit, this has proven to, I know one specific veteran from Iowa who was told he'd never walk again, and going through 6 months of rehab in the Minneapolis VA with a device we donated, he was able to walk his daughter down the aisle at her wedding. So it does work.
Let me just note that I had serious troubles with my arms, and I know a lot of veterans get this as well. Actually, all the cartilage was gone. I'm a surfer, and I ended up surfing all the cartilage away in my arms. I know how painful that was, and what's really helped is I have had shoulder replacements that were, I believe, developed to help our veterans, and now they've helped all of us. Do we have a situation where veterans are having to wait? Because I know how painful that was. Are veterans having to wait to use the technology that we've developed?
I think the question is whether they're actually getting the technology via the VA or through private facilities. So private rehabilitation facilities will get it much more quickly, and it's much more accessible than going through the VA process of them going through the FDA approvals, whether to get the funding or not, because it doesn't come from VA here in Washington. It's each individual VA has its own budget, and so it's up to them to figure out what they deem appropriate or necessary for their veterans' care, and so that's where we step in.
Well, new technologies and new medicines are really elongated in the process for us to use them. And when you mentioned batteries, about how new batteries will probably help in many of these challenges that we face for helping the disabled, let me just note that there are new batteries on the way. And Dr. Goodenough, the inventor of the lithium battery, has had a major breakthrough that should have an incredible impact on the things we're talking about. But then again, we have to make sure that the FDA approves the use of these batteries and everybody else approves the innovation all the way down. So I'm very pleased that you alerted us to the bureaucratic problems that have to be overcome in utilizing new technologies for our veterans. Thank you very much.